Hi, everyone. I'm Rachel Madley. My pronouns are she, her, and I am a SNaHP Executive Board member. I'm very excited to welcome you to our 2021 SNaHP Summit. And our theme today is Unite to Fight, and you will see that reflected in our different speakers and sessions. And we really encourage you to join our Summit GroupMe to stay up to date if you have any technical issues or just continue the conversation from what you are going to hear today. Now, our sessions are being recorded, just so you know, and right now we are in webinar mode. And so if you have any questions or comments, feel free to drop them in the chat. Feel free just to introduce yourself and where you're from in the chat. And also, we encourage you to share your experience on social media. So you can use the hashtags found on this slide. And we will also be live tweeting. So feel free to amplify those tweets if you see one that you like. And so just a quick overview of the agenda. So for the keynote session, as well as the next panel, we are going to be on the same Zoom link, but then we will be going to different Zoom links for our breakout groups. And you should have received all of those links in an email, but they're also going to be dropped in the chat, so you don't need to worry about finding those links. And so right now, I am very excited to introduce Dr. Susan Rogers, who is the president of Physicians for a National Healthcare Program, and she is going to kick off our summit. Now, Dr. Rogers received her medical degree from the University of Illinois College of Medicine and completed her residency in internal medicine at Cook County Hospital. She's past co-president of Healthcare for All Illinois and was previously the medical director of the Near North Health Service Corps, an FQHC in Chicago, and remained on their board for many years after. She's also a fellow of the American College of Physicians and a member of the National Medical Association. And we at SNaHP are very excited to hear from her, as she has just been a tireless advocate for Medicare for All and an amazing PNHP president so far. And so with that, I will stop my sharing and turn it over to Dr. Rogers.
Well, thank you so much for that kind introduction, Rachel. And I'm really happy to be here to welcome the group. I was honored to be the keynote speaker last year at the summit when we could meet in person, and we were out in Colorado back then. But I'm really excited that SNaHP chapters are growing, they're getting larger, the numbers are increasing, because I really see as you as students, and then as you become residents and attending physicians, to be a crucial part of this whole movement to helping us achieve Medicare for all. I became active in PNHP probably around 2007, 2008, after Obama became president. And I said, you know, I was always a single payer supporter, but I wanted to become more articulate about it, to be able to argue for it, and to be an advocate of the single payer movement. And so my activity has increased since then, my knowledge about single payer, and the realization that the system that we have now is just so wrong and unfair, and it doesn't work. And it still is frustrating as to why people don't see that. When I trained at Cook County, now, this was a long time ago, and I will admit that was when penicillin killed everything. So that'll give you an idea how long ago that was. But it was almost like practicing in a single payer system. When I saw a patient, we decided what needed to be done or what didn't need to be done, what they wanted to do, what was necessary. I never asked a patient what kind of insurance they had. I never asked a patient, would this be covered? Can you afford this medicine? It wasn't part of the medical conversation between a provider and a patient. Back then, we pay at Cook County, the healthcare was free, it was subsidized by the government, medications were free. However, over the years, as this medical industrial complex grew and became more powerful, Cook County was impacted by that. We started having Medicare we started having privatized Medicaid patients, and so that kind of restricted what we could do. We had to have co-pays for our medications. So it was much more difficult to provide the care that we knew was needed for our patients. Fortunately, we did have some social service support to address some of the issues with the social determinants of health. But the financing of healthcare changed over the years that I have been practicing as an attending, and it has directly impacted care. And I can tell you that it's much different now as a practicing physician than it was when I started my training. And that's why it's so important to me too, that we achieve single payer so that you, if you choose to become practicing physicians, staying active in the clinical world, that you enjoy practicing medicine as much as I did. I loved being a clinician. I've never published a paper. That just wasn't me. There's a role for that. We all have our roles. And I think that's also something we need to admit to. Some things we like doing, some things we don't. And I think it's good to focus on what you like doing as long as it serves the purpose of your long-term goals. But I enjoyed being a clinician, and I know many of you, that is despite, your social activism, you still want to be a practicing clinician. And I hope you enjoy it as much as I did, which means we have to get rid of this administrative burden that's placed on physicians that it is today. We have to get away from you dealing with the emotions of having a patient that you're not able to take care of because of insurance barriers, because of financial barriers. It's a tremendous burden that's placed on our shoulders that is totally unnecessary, totally unnecessary. We have a system that will eliminate that, and that's our single payer system, Medicare for all. So I think it's important now more than ever. And with the climate in the country now, the racial climate, the inequities that have always been here, but they have been made more visible by the pandemic, by the violence from the police, by the obvious inequities in every aspect of life that occur in this country. And we all know that Medicare for all will not eliminate those. There's no way that it can eliminate those, but it will, what healthcare access and healthcare itself will provide is opening the door to helping address other inequities. Somebody who is unhealthy cannot deal with other issues in their life, such as housing insecurity, food insecurity, transportation insecurity, education for their children. There's a lot of things that when you are healthy, you are in a much better position to deal with those issues than when you are not. So even though healthcare access and care itself will not eliminate all the inequities that this country has created, it will allow you to be able to function better in life. And as a country and communities, we would all be healthier and we can all be productive in supporting those communities. And so more and more people nowadays are being left out of the healthcare world because they cannot access it because of the system that we have now. Right now, workers are paying incredible amounts of money before they even can access care. With a family plan now, workers on average pay almost $5,000. That's taken out of their check. That's money that they don't even see to cover the balance of the healthcare premium to the private insurance companies. And then after that, they also have a deductible to pay that doesn't, so the healthcare dollars don't even come into play to pay for your healthcare costs until you've paid that deductible. And it's almost like if somebody gives you a car and you say, here's your brand new car, but you don't have the keys, you have a car that's worthless. And that it was mentioned before in the Single Payer 101 talk that having access does not mean you can get care. If you can't pay that deductible, no matter what kind of insurance card is in your pocket, you can't access the care. So hopefully you all become active advocates in this. People in my age group are getting older, so we need the youth and the energy and the enthusiasm that you all have to help carry on this fight so that we can actually get what we need. The whole works better when everyone can contribute, and everyone can contribute when everyone is healthy. And that just because someone lives in a different neighborhood, there are still interactions. And to keep resources out of some neighborhoods and not in others really affects the health of all neighborhoods. It's important when you go to a restaurant that the person who's serving your food is healthy, that the person who's serving your food has access to a COVID vaccine, that the person who's teaching your children has access to a vaccine and is healthy. These are all interactions just every day that we don't think about it, but we are dependent on other people being healthy so that we can remain healthy. I know that when my children were born, I had a woman who came into our home to take care of my babies. And she didn't have health insurance, but she told me she had hypertension. And so I paid for her to go to the doctor, paid for her medicine. And fortunately, I was able to do that because the last thing I wanted was for her to be at home with my babies and have a stroke or an acute coronary and something and not be able to do anything about it. Why should I put my babies at risk because of someone who works for me is not healthy? So it all intertwines. And I think that we have to acknowledge that the world is not cut up into little pieces that are separated. We're all here together, and it's not that everybody has to be your best friend. You just want them to be healthy and they can do whatever they want. But in our day-to-day interactions, it's important that we are all healthy. And that's what Medicare for All will help address, because we all need to be healthy in order, not just individually that we can function, but so that our worlds are healthier and that world in which we live is healthier and that we can all function better. So I don't know how long you want me to keep talking. I'm not sure when the keynote is going to start, since one of the things I will say though is that the challenges that are facing this movement now have really opened a window, I think, that will make people a lot more receptive to what we're saying. And I think that the fact that there isn't a public health system that makes everyone healthy. We saw that with COVID. We had no health system here to address it as a nation. And even now we're struggling with each state, can do their own thing. I don't know if you heard the comment that Neil deGrasse, the astrophysicist, said about COVID. And he was saying that if you have one state that has masks and you have another state that has no social distancing or whatever, it's like having in a swimming pool, you can pee in this section. It doesn't matter. You're all exposed to the pee, no matter where you are in the pool. And that's how we have to look at all of this. It's that you need a public health system. You need a system that addresses all the issues, that coordinates the care, that provides us all with good health. And again, that's what Medicare for All will help address. It doesn't address a public health system. Having Medicare for All will not make sure that nobody's peeing in the corner of the pool, because they will. But we at least can make sure that we can get treated if there's something in that pee. And so we can't make states, that's a whole separate problem, even though this would be a federal program. Single payer will be federally funded and privately delivered. But there still needs to be a public health system that coordinates all this care. And that's important in addressing the lack of hospitals in certain areas in this country. Rural closings, there's been, I'm blanking on the number, 120 or 170 hospitals that have closed in rural areas in the last 10 years. Hospital closures in poor communities in urban areas are closing. There's a big one here in Chicago that we're talking about that is closing in a South Side area. Used to deliver 3,000 babies a year. They're closing now. And now they may have 1 or 2 a week. Where are those women going? Certainly now they have to leave their community. And I think, getting prenatal care has enough hurdles as it there's already hurdles in accessing that care when you are poor, when you don't have transportation, if you have childcare issues for your other children that you may have, and then to have to leave your community to get the care that used to be there, are just hurdles that impact on people's lives that are just unnecessary. And it's not the impact just on their health care. It's an impact on all aspects of their life. And that's why addressing healthcare issues are important, because they help, like I said, they open the door to help addressing the other issues that you may be facing. And we all have those. We know that when we get sick, we put things on the, we take them off the burner because we can't address them now. And it's one thing to put off buying a pair of shoes because you're sick. It's another problem if you're not able to address your housing, if you're not able to address your childcare issues, if you're not able to address transportation so that you can go to work. So I see Dr. Julie is on. So
Exactly.
looking forward to hearing you. So I will end my comments here, and I will leave it to you, Rachel, to continue on. But thanks for asking me to address the opening, and I'm looking forward to the rest of the conference.
Well, thank you so much for all of those comments. I think they really resonate with us students in SNaHP, especially the point about how everything is so interconnected, which kind of is where the theme for today of Unite to Fight came from. And so we really appreciate your time, and we're excited to see where PNHP goes with you as continuing to be president. So thank you everyone for signing on. I just want to make a quick note. Live closed captioning is available. You will see the option down at the bottom of your screen if you do want to turn it on. And now I am going to turn it over to Natasha, who will introduce our keynote speaker.